As we begin the month of May, we're also beginning National Stroke Awareness Month. Every 40 seconds, someone in the United States has a stroke, and every 3.5 minutes, someone dies. Deaths can be prevented by knowing the warning signs and acting quick. Joining us live to talk more about this important topic is Dr. Augusto Elias, who works at the Comprehensive Stroke Center at University of Michigan Health West. Thank you for being with us today, Doctor.
Thanks for having me.
Well, noticing the signs of a stroke is so important. There's an acronym for it, BE-FAST. Can you explain what that means?
Sure. That's the acronym that we use in order for any person, including children, to identify stroke symptoms of their relatives or loved ones. And the B stands for balance, right? I mean, people losing their balance. The E stands for eye movement, or not being able to, track a person or cross the midline of vision. The F is for facial drooping. The A stands for arm and leg weakness. The S stands for speech, not being able to understand the patient or the person. And the T is time to call 911. We always want to emphasize that, responding EMS services is the fastest way to take your relative, loved one to the hospital.
Right. It's certainly easy to remember when you have the acronym there. So strokes are incredibly dangerous, but not all strokes are created equal. So can you explain the different types of strokes and what are really the most common ones?
Sure. Strokes are divided between ischemic and hemorrhagic stroke. Ischemic tends to be the more common one, and about 80–85% of the time. And what that means is that a clot that can come from the heart or the neck, carotid arteries, travels to an artery of the brain and plugs it. And that creates lack of blood flow and therefore oxygen to go to the brain tissues. And that's the more classic symptoms that BE-FAST represents, and the ones that we want to identify and take the patients in a timely fashion to the hospital. The other type of stroke is called hemorrhagic stroke, which stands for a bleed stroke, right, or a bleed attack. And that's when either a small vessel in the brain tissue ruptures, or there's a bleb called an aneurysm that ruptures, and then those are unfortunately very disabling and debilitating as well.
What are some of the measures that we can take to protect ourselves?
So, the latest research is showing that, at least the ischemic one, stroke, the one that, that causes the clot, it's basically preventable, right? I mean, I think with a balanced diet, easier said than done, of course, alcohol in moderation, no tobacco smoking, blood pressure control, doing some moderate exercise. A lot of these strokes can be prevented. So those are the preventive factors for a stroke. In terms of the hemorrhagic ones, they're harder to detect. People who have these unusual type of headaches, usually behind the eye, or not being able to, move that one eye, seeing double, are usually the warning signs that a hemorrhagic stroke or that an aneurysm is going to rupture.
Okay. Dr. Augusto Elias, thank you so much for joining us. We appreciate your time.
Again, thanks for having me.